Hey everybody, it's Meredith with EmpoweredMochaPatient.com, and I decided to share this little video to give you guys a little bit about my personal patient experience when I had my fibroid surgery. About 10 weeks ago, I had a laparoscopic myomectomy to treat my fibroid, and I'll share more about what that is in just a minute. Those of you that are unfamiliar, a uterine fibroid or fibroid tumor is a non-cancerous tumor that grows either inside or outside attached to the uterus. Up to 80% of women of childbearing age can have these, but they may not always cause symptoms or problems. However, in African American women, we seem to be a bit more prone to fibroids than some other ethnic groups. About 5 years ago, when I went to my annual GYN exam, I mentioned to my doctor that my menstrual cycle seemed to be getting a little bit longer and sometimes coming earlier than expected. So she gave me an order for an ultrasound to look at my stomach, and the results showed that I had a fibroid. But at that time, it wasn't especially big, and I wasn't losing an unhealthy amount of blood, so she just recommended that we keep an eye on it. So I was supposed to have an ultrasound every year or two after that. But in 2012, my ultrasound results showed that it had grown significantly and that it was time to consider some treatment options because it was starting to press on my kidney, and that could eventually lead to kidney damage. So when considering treatment options, the doctor asked me if I had children or if I wanted to have children, and then she gave me 4 treatment options that would still allow me to be able to have children in the future. The first treatment option was Depolupron to shrink the tumor, which is a hormone shot that causes basically temporary menopause with hot flashes and all that. But the risk is that it would grow back as soon as I stop the shot. The second option was to wait for 6 months and have a repeat ultrasound to see if it had grown or if it was remaining stable. The third option was minimally invasive surgery to have it removed, and then the fourth option was to have a full open abdominal surgery, which would be a lot like a C-section. So of course, I decided to wait and see. So about 8 months later, I had the repeat ultrasound and it was still continuing to grow, and my GYN was like, this has to come out. So I decided to try the minimally invasive procedure. So she referred me to a surgeon who specializes in minimally invasive procedures for fibroids. At the pre-op appointment, the surgeon reviewed my ultrasound results, and she determined that I was a candidate for a procedure called a minimally invasive laparoscopic myomectomy. We discussed how she would perform the procedure. That would be making 3 very small incisions in my stomach and inserting a camera so that she could see what she was doing with the surgical instruments. I could expect a recovery time of about 2 to 3 weeks off of work, and I could possibly even go home the same day, depending on how I felt. But I would need to be prepared to stay the night. Then we talked about risk and complications associated with the procedure. A common risk is blood loss, and I possibly would need to receive a blood transfusion either during or after the surgery. Another risk of the procedure is that it cannot be safely completed through the small incisions, and she would have to make a larger incision that would be like a C-section. After she made sure I understood all that, the risk and complications, she wrote an order for me to have an MRI of my stomach so that she could get really clear images of my fibroid and then plan the approach for the surgery.
Your blogger, so the hospital that we currently have, they taking great care of you?
Yes, they have. They have checked my identity to make sure that I am the correct patient. They started my IV. They asked me all the appropriate questions. So, I'm nervous, but I'm good to go.
Okay. So, I don't think you should be nervous.
Thank you.
So, anything you should tell your blogger so far about your condition and the procedures?
I'm having a large fibroid removed. It's bigger than a grapefruit. That's it.
So, after your surgery, how do you feel?
Not good. I lost a lot of blood.
Do you have to stay here overnight, or you can get to go home?
I have to stay overnight.
So you say you lost a lot of blood. What are they going to do to fix that?
I have to get a blood transfusion. I have to get 2 units, which I am not happy about.
I can tell by your face you're not happy.
As you can see, I did not feel the greatest coming out of surgery. It took longer than expected, and I lost a lot of blood. As a result, I had to receive a blood transfusion, 4 units to be exact. Despite my fibroid being very large, I was fortunately blessed to have a successful laparoscopic myomectomy. I have 2 small incisions, both less than an inch wide on my stomach, and a larger incision hidden inside my navel. But it has been 10 weeks since my surgery, and I really feel much better. I no longer have a knot in my stomach when I press on it, and my surgeon said that my uterus should be fully healed within 6 months of the surgery. Now I just need to follow up with her at the end of the 6 months to have a test that checks to see that my fallopian tubes are still open and I don't have any internal scarring that could complicate getting pregnant. So that was my personal patient experience. I would encourage you to talk to your doctor if you think you may have fibroids. It's important that you do so sooner than later before they grow too large or cause you a lot of pain, bleeding, or organ damage. There are a few different treatment options available that will most likely preserve your fertility if you desire to still have children in the future. But each woman is different, and her situation is different, and the treatment options will depend on the size and location of the tumors. But you can discuss all that with your doctor. But do your research and get a second opinion if that makes you feel more comfortable before making a final decision. I hear about a lot of women choosing to have a hysterectomy when there are actually other treatment options available that might be more suitable for them. But for more information about fibroids, see the description box down below for some helpful links to resources that you can research. And don't forget to check me out on empoweredmokapatient.com. Thanks for watching today, and let me know if you liked the video so that I can keep them coming. Blessings and good health!